Today, women have choices about who they want to care for them during labor and delivery. You deserve a hospital you feel comfortable with and one that supports the type of birthing experience you want. I'm Joni Wadian, one of the nurses here at Mercy Maternity Services, and I want to welcome you to Mercy Medical Center, a designated Anthem, Blue Cross, Blue Shield, Blue Distinctive Care for maternity care. The only Stark County hospital selected to Newsweek and the Leapfrog Group's list of the best maternity hospitals in 2020. Before we take our tour of our maternity floor, I want to share just a few things about Mercy Medical Center. We offer 24/7 emergency care during pregnancy. If you experience medical complications related to pregnancy at 20 weeks or greater, we have a specialty emergency department just for expecting moms. It's our OBED, and it features round-the-clock staffing by board-certified obstetricians, nurses, and healthcare professionals experienced in labor and delivery. And if you experience complications under 20 weeks pregnant, our Mercy Emergency Department is here to provide you with comprehensive and compassionate care. At Mercy Maternity Services, we do not have residents. If your physician is unavailable, we offer an in-house OB hospitalist who is available 24 hours a day, 7 days a week, along with bedside direct nursing care. Our primary C-section rate is significantly lower than the average in Ohio. For babies born at 32 weeks or greater who need a higher level of care, Mercy offers a Level 2 special care nursery and neonatology on call around the clock. And if your baby needs care in the special care nursery, Mercy offers kangaroo care with special chairs for skin-to-skin contact. We have certified lactation consultants who offer free breastfeeding guidance and consultation to help you meet your personal breastfeeding goals while having a positive and rewarding experience. And the support doesn't end when you leave the hospital. Mercy offers free consultations after you're discharged. Mercy is a 3-star hospital in the First Steps for Healthy Babies program for our work on maternity care practices to support breastfeeding. And finally, our most cherished asset is our staff. Whether your labor is short or long, delivery is vaginal or cesarean, you choose an epidural or deliver natural, our nurses are here to help support you every step of the way. This compassion is what makes Mercy's nurses remembered long after the birth of your baby. Women do not have to choose between a safe but clinical labor and delivery or a comfortable, homey birth. Mercy Medical Center offers the birthing center experience with the peace of mind of nearby medical care. Let's go take a look. As you pull into the hospital when you come in labor, we would like you to park in the parking deck. As you come out of the parking deck, you're going to come down the hall past the professional pharmacy and the gift shop. The gift shop has special hours. And then you're going to pass Subway. Subway is open 24 hours a day, so there's always a place for a support person to get something to eat. As we come around the corner, there's the professional medical office building elevators. You're going to pass those, you're going to come around the corner to the main entrance of the hospital where the main lobby is. As you come to the main entrance, you'll notice the door is locked. Someone will let you in unless you come in labor after 7 o'clock at night and before 7 in the morning. Then you'll have to come through the emergency department. The corridor going to emergency department is always open. In maternity, we allow one support person. That person can be with you during your whole stay. We do not switch visitors back and forth, so one person will be your support person. As you come into the emergency department, you can park off to the right, then come through the doors up to the check-in desk and tell them you're in labor. They will get a wheelchair and take you up to the maternity department. Once you're situated, your support person can come back down and move the car to the parking deck. The double doors that face the circle are for patient drop-off and patient pickup. So when it's time for discharge, we'll have Your support person go out, bring the car around the circle to these doors. We'll bring mom in a wheelchair with baby in her arms out to the car. As you come through the door, you stop at the desk and they're going to screen you. They're going to ask you some questions and they're going to check your temperature.
No headache, fever, shortness of breath, loss of taste or smell. All right, just gotta get your temp. There you go, good to go.
As we enter the main lobby, to the right is the information desk, and then over to your left is security. And then across the hall from security is vending on the right. As you come through the main lobby, you're going to go off to the right to maternity. Straight ahead is what we call registration or admitting. But first of all, I'm going to take you off to the left to show you the outpatient lab. Sometimes babies can get a condition called jaundice, and the pediatrician may say, sure, you can take the baby home, but here's a prescription for you. Bring them back to the outpatient lab. They have certain hours at the outpatient lab, so please check before you come in. Take this corridor back to the main lobby seating area. As you come around the corner, you're going to go to elevator A, which are the visiting elevators. Just follow the OB emergency room signs. As we come around the corner, I want to show you these elevators. They're for staff use. So if you come through emergency room, they're going to bring you through the double doors up these elevators up to maternity. But I want visitors to use elevator A. As you look down the hall, it kind of S's around. That's where our chapel is. It's in the old Mercy swimming pool. We also have elevators on the left that take you down to the cafeteria, which is in the basement, or we call the ground floor. But you can get there by elevator A's. We're going to go into elevator A's up to the second floor, which is where maternity is. You're going to push the button 2, and as you notice, there's buttons for the cafeteria, which is in the ground floor or the basement, and then the main lobby is the first floor. As you walk up to the double doors, you notice we're a locked unit. There's an intercom button on the wall. You're going to push that button and introduce yourself. Then they will let you in. If a visitor comes, they must give mom's first and last name or we won't let them in the door. To exit, you come down the hall and you're going to push that intercom button again so they can let you out. There is a camera, but if they don't see you coming down the hall, push the intercom button and they'll let you out. Another security thing we have in place is our pink badge. As you walk through the department, notice the staff. All maternity wears pink badges. No one else in the hospital has a pink badge. So if someone would come in your room and say, I need to take your baby to the lab for blood work, and they don't have a pink badge, you're going to say, no, I'm going to call my nurse. Off to the left is our special care nursery. This is our parents' entrance. So if your baby's in special care, you're going to come in the door, follow the instructions on the wall, and wash your hands. And then around the corner is an intercom button to push and introduce yourself, and then the nurse will come and let you in. We are a level 2 special care nursery, which means we take care of babies that are 32 weeks and above. Let's say you came in labor and you were only 30 weeks and you were ready to deliver. We will help you to deliver, we will stabilize the baby, but then we will transfer the baby out to a level 3 hospital. As we come down the hall, off to your left, through these glass cases, there's many items that are available down in the gift shop. You'll notice we have breast pumps also available here. We have electric ones for your use, and if you need to rent one, we can also rent a pump to you. Before you go and buy a breast pump, please check with your insurance, because most insurances are sending them to your home a month before you come in to have your baby. Next, we're going to walk up to the main nurse's station. The unit assistant is going to hand you a piece of paper.
Hi, can I help you? Would you mind filling this out
We'd
for
like
me?
you to fill that out with your name and your doctor and the reason you're here. and then that way we know what room to put you in. So if you're not sure if you're in labor or if your water broke, we're going to put you in one of these OB/ED rooms. As we go into the OB/ED room, we're going to put you on a cart, hook you up to the monitor, and ask you questions. There's no TVs in this room, there's no beds, we just have a restroom and the carts and the monitors. Once your assessment is completed, the OB/ED doctor will be in to see you within 30 minutes. When they admit you in labor, we're going to move you down to a labor room. We have 10 labor and delivery rooms. You're going to labor in these rooms, you're going to deliver and recover for 2 hours, and then we'll move you over to the postpartum side for the rest of your stay. As you see the red tag on the door, it means you're in labor. So let's go through the door into the labor room. As we walk into the door, we're going to hook you up to the monitors. You can see the communication board. Your nurse is going to put her name up here and her number. It's a 4-digit number. And we encourage you to use the tan phone to call your nurse. You'll get her directly. You can push the nurse's call light, but you're going to get the secretary, and then she has to find your nurse. So your best bet is to use the tan phone. We have recliners for dads, because sometimes labor takes a while. The average first-time labor for moms is 12 to 24 hours. So he does have a place to sit down and lay down and rest. We have TVs in the room. We also have other things that you can use to aid in your labor. We have birthing balls and peanut balls. The best position for labor is upright. So using the peanut ball while you're in bed or upright on the labor ball will help the progression of your labor. Another tool we have is telemetry monitors. So you're not stuck in bed. You can get up and walk around. You can go down the hall. If you do have to stay on the monitor, we can watch you and your baby. We have a baby warmer. We also have a baby crib. We also have a shower and a tub in the rooms, and then your toilet, and then your sink. There's hand sanitizer on the wall, and we encourage everyone to use the hand sanitizer before they touch the baby, because we want to keep our little ones healthy and safe. We do have a second nurse's station called the substation down at this end of the hall, so if you're a patient down here, you may find your nurse in the substation. And here's the kitchen. Your support person can come into the kitchen and get you whatever you would like. Here's the ice machine, and then here's the refrigerator for clear liquids. We have Sierra Mist, ginger ale, and Jell-O. You can use the microwave too for after delivery if you need to heat anything up. Once the baby's born, the doctor's going to put the baby up on your chest, skin to skin. We call that the golden hour. We're going to leave the baby up on your chest through that first feeding. Then once the baby eats, we'll put the baby over on the crib. We're going to call the nursery nurse. She's going to come in and transition your baby, which means she's going to assess your baby and then call your pediatrician. Meanwhile, while they're assessing the baby, you get to eat. Now, we don't feed you during labor, but you do get clear liquids. And I'll show you where the kitchen is in a little bit to get your clear liquids. Or you can call the cafeteria. Our vaginal deliveries stay for 2 days. Our cesareans get 3 days. You don't count the day of delivery. It's 2 days after you deliver, or 3 days for our cesarean sections. After you deliver and recover for 2 hours, we will get you up to the restroom, put you in the wheelchair, and then we'll put the baby in the crib. Your support person can push the baby in the crib while we push you in the wheelchair over to postpartum for the rest of your care. If you have to have a C-section, we have our own unit up here. It is a locked unit. So if your support person needs to go into the back, they have to stop at the desk and they will buzz them in. As we walk through the double doors, we'll go to the nurse's station. Next to the nurse's station is a chair for the support person. You're allowed one person in during a case, as long as mom's awake. We have 2 ORs. We only schedule 1 C-section at a time. That way we have a second one available in case someone comes in or it's an emergency, we have a second OR. We also have 2 recovery rooms. We have a main recovery room, then our second recovery room. The second recovery room is also used for overflow. If all the labor and delivery rooms would be full, we can labor, deliver, and recover a patient back in this L2. C-sections take about an hour. The baby's out in the first 10 minutes. What takes longest is sewing you back up. You're awake for the delivery, so you get to see the baby. As soon as the nursery nurse checks the baby out, they're going to bring the baby over to you, and we do skin to skin in the OR. The baby will stay in the OR with you until you're ready to get moved to recovery room. Then you're going to go to recovery room for 2 hours. After you're finished recovering from a C-section, we'll take you down the hall to postpartum. As you see these double elevators, you'll notice they do not open on this floor, and that's part of the security to keep you and your baby safe. Another security measure is the band. It's called the code alert band. When your baby's born, we're going to put the monitor on the baby's ankle. If you think it looks too tight or it's too loose, please let your nurse know, and we can go to the monitor and adjust it so you don't set the alarms off. Next to the elevators, we have vending here for your support person. They can take whatever they want into the family waiting room, or you can eat in mom's rooms. Or if you need to go to the cafeteria, you can bring any food up also. As we walk down the hall through these double doors, this is the postpartum unit. Off to the left is the family waiting room. In the family waiting room, there's comfortable couches to sit in. There's TV and a restroom. This door is the lactation consultant's room. So if she says, meet me at my office, this is where you'll come. This is our postpartum unit. We have 17 postpartum rooms. On the right are the large rooms. On the left are smaller rooms. It's first come, first serve. So we're going to fill up the large rooms first and then the small rooms. Your support person can bring in any food that you want. Food from home, food from Subway. Some people even order pizza. You can eat whatever you want in the room or order from the cafeteria. As we walk down the hall, you'll notice the nursery off to the right. You'll notice it's a locked unit. No one can go into the nursery. If your baby's in the nursery and you want to get the nurse's attention, you pick up the phone and push the intercom button to get her attention. There's 2 reasons your baby would have to come to the nursery. Number 1, for a hearing screen. Number 2 is if you're having a boy and you want him circumcised, there's a room in the back, which is our procedure room. The circumcision will be done. We don't allow any pictures through the windows because of the HIPAA laws, the Privacy Act. As we walk down the hall on the left, you'll see the nurse's station. You'll notice there's no secretary at the desk. So that's why we encourage you to call your nurse with the tan phone. You can push your nurse's call light, but it's going to go to the secretary at the front desk, and then she has to find your nurse. As we go into the room, we have air conditioning on the wall that you can regulate. As we walk in the room, you'll notice the big rooms have a couch. There's the bed, the sink, and the bathroom. There's also 2 closets to keep your things in while you're here. Across the hall are the smaller rooms. In this room, you will notice there is not a couch. There is a recliner, though, for your support person to spend the night. There's the bed, the TV, a closet, and then the restroom. The ironic part is the bathrooms on this side are bigger. As we come down the hall, you'll notice there is a kitchen, which has a nice machine, refrigerator, and a microwave. If you want to walk around the halls with your baby, make sure the baby's in the crib. You can walk down the postpartum hall or down the labor and delivery hall. But when you come to these signs, we want you to stop. We don't want you to get close to the exits because you will set off the alarms. And that's the end of the tour. Thank you for considering Mercy. We look forward to taking care of you. If you have any further questions, please call Maternity Services at 330-489-1039. Have a good day.